All right, let's dive in. Today, we're flipping open the Medical Detective's Handbook to crack the code on what is, without a doubt, the most important conversation in all of medicine, taking a patient's history.
And where are we getting our intel? Well, our guide for this whole investigation is a real practical manual used for nursing students over at the University of Basra's College of Nursing. So this gives us a fantastic inside look at how healthcare pros are trained to become these skilled medical detectives. Have you ever really stopped to think about that? Before a stethoscope even comes out, before any lab tests are ordered, the very first tool any doctor or nurse uses is just a conversation. So what makes a few simple questions so incredibly powerful? Well, because it's not just a friendly chat, it's a full-on investigation. Every single question they ask is specifically designed to uncover a clue and to piece together the puzzle of what's really going on inside your body.
So here's our game plan. We're going to start with why this is so much more than just paperwork. Then we'll get into the story of now. After that, we'll dig into your health's history, look at life beyond the illness, and then, finally, put all the pieces together to solve the medical puzzle.
Okay, so first things first, why all the questions? Let's take a look at the actual mission behind this whole investigation.
You know, it really boils down to three key things. First, it sets up a baseline, a starting point for all your care. Second, it's about spotting the problems you have right now and any potential problems that might be down the road. And finally, it's a huge part of their training. It helps them develop those sharp communication skills that every good detective absolutely has to have.
All right, now we're arriving at the scene of the crime, so to speak. We're focusing on the immediate problem, which is where those first crucial clues start to pop up.
Believe it or not, this entire diagnostic journey, this whole massive investigation into your health, it all gets kicked off with one single, focused question.
And here it is, pulled straight from that nursing guide. The pro is trained to ask for the main problem that brought you in and how long it's been going on. And, this is key, they need to hear it in the patient's own words.
This has a name, of course. It's called the chief complaint. And honestly, the best way to think about it is like the headline of your medical story. It's that short, punchy reason you're there. I have a sharp pain in my chest, or I've had a fever for 3 days. It's the starting point. But of course, a headline never tells the whole story, does it? No one gets a diagnosis based on the headline alone. The detective needs all the details. And this is where they really start digging into what's called the history of present illness, breaking down that chief complaint from every possible angle. Now, any good detective knows that clues can hide in the most unexpected places. This is what's called the review of systems. They'll start asking about things that seem totally unrelated, like your digestion, or your sleep, or your mood. Why? Because a headache might actually be linked to something you ate, or feeling tired could be connected to your breathing. They're searching for those hidden connections. To truly understand what's happening in the present, a detective has to look to the past. And that means digging up clues from both your personal health journey and from your family's. So the investigation really looks at two different timelines. Past history, that's all about your story. Childhood sicknesses, any surgeries, hospital stays. Then there's family history, which is about genetics and the environment you share, what runs in the family. One tells the story of your journey. The other is like the map you were given at birth. And both are absolutely crucial. But here's the thing, you are so much more than just a collection of symptoms or past illnesses. A really great medical detective knows that your life, your environment, that's where some of the most important clues are hiding. This part is called the social history. It dives into your environment, where you live, what you tend to eat, how well you sleep, even your habits with things like tobacco or alcohol. And listen, these aren't lifestyle judgments, they are essential clues. Your daily life is often where the most critical pieces of evidence are found. And nestled within this section is something that is absolutely critically important, your drug and allergy history. They need to know every single thing you're taking, the name, the dose, how you take it, and when. This is a vital safety check to prevent any harmful interactions and to really understand your complete medical picture. So, the detective has gathered all these clues from the present, the past, and from your daily life. Now it's time for the big reveal, seeing how all those pieces fit together to finally solve the puzzle. It's so important to realize that the patient history, the story that you tell, is the foundation for everything else.
It's the piece that guides the whole investigation. It gives context to the numbers from your vital signs, it directs the physical exam, and it helps them decide which lab tests are even necessary. Without your story, all the other pieces are just data without any meaning.
And all of this evidence, all this incredible detective work, it all leads to one thing: action. First up is the nursing diagnosis, which is the professional's conclusion based on all that evidence. And from that diagnosis, you get the nursing care plan, the real, concrete, step-by-step strategy to help you get better.
So the next time you're in a doctor's office or a hospital and someone starts asking you questions, just remember, you're not just a patient. You're the lead witness in the most important investigation in the world, the one about your own health. So the real question is, what clues are you going to help them uncover?